So this is just to serve as a charting reminder about end of shift summaries, or what we call the progress note. And there are three specific folks here that we're really going to need to fill these out on. And that is your artificial airway patients, your V60 patients, and your ventilator patients. So when it comes to your artificial airway patients in general, you need to put in pertinent information about the patient and the relation with the aforementioned care. In addition to this, special considerations and goals for the patient in relation to the aforementioned care need to be discussed here. So we have PMV trials, swallow tests, specialty care of the trach or the endotracheal tube, and then skin integrity issues need to be mentioned in the artificial airway. So we can discuss weaning in here. We can discuss interactions with the patient, training, education, etc. But that's what needs to go into the artificial airway section. Also in here, with the endotracheal tube, we can discuss change outs of Hollisters, skin integrity with the Hollister, with the trach use or cleaning routines with the trach, skin integrity with the trach as well. So that's what we're going to have for the artificial airways. For the V60, again, pertinent information about the patient and the relationship with the device, how they tolerated it. If they didn't tolerate it, what corrections you need to make for them to tolerate it, changes in pressure, physicians you may have talked to about strategies with the device, that sort of thing is going to go in here. Rationale for selective pressure, rationale for specialty modes if you're using AVAPs, etc. That's what needs to be in the V60 or the BiPAP, if you will. I just put V60 down today in the BiPAP section. We can also do this with CPAP patients too as well. Also, I just want to cover MEPLEX use on the V60 and our key four skin assessments that we should be doing in the critical care areas, or patients of special concern who have frail skin or on pressors, etc. That needs to be included in this V60 section here. So that would again include your MEPLEX use, or mask rotation strategies too are going to be charted in this V60/BiPAP section. As for the vent, again, how is the patient interfacing with the vent, interactions with the physician that you may have had, strategies you may had to have used with the patient, notes that we need to have to see how this patient's interfacing with this mechanical ventilator. Some areas of discussion could be weaning trials, special procedures completed with the patient, um, where you went with the patient. A lot of folks will put under the ventilator one their endotracheal tube, specific cares, for example, the Hollister, tightness, skin integrity, that can be lumped into that ventilator as well. Trips, the CT, MRI, special procedure lab can all be included in that end of shift summary for the ventilator. Trials are important, but also remember we need a chart in the vent or in the ventilator trial section of um, Cerner as well. So these need to be filled out. The general rule is if you've taken care of the patient for greater than 4 hours, these need to be filled out. Some other things that have come up in recent years, we often put high flow patients on these, especially high care, high flow patients. We want to know if there's correct or changes made. Again, evolving plans of care with the patient, moving from the high flow to a super cannula, back from a super cannula to the high flow. That can be included here as well. But the three bigs that we need to do are artificial airways patients, our endotracheal tube patients, our BiPAP patients, and our ventilator patients. With the CPAP, with a little spur off of that, if they're a nocturnal CPAP unit, a quick progress note saying when you put them on, or if there are any issues with the CPAP device through the night, how the patient tolerated it, can also be used as an end of shift summary too as well. The last group of patients that we tend to write end of shift summaries on, a general summary, is somebody who's receiving lots of care, maybe a patient who has quadriplegia or paraplegia, is on a couple of different protocols. We're working through different therapy routines with them, maybe a cough assist and an IPV, et cetera. We need to be putting in end of shift progress notes on how that patient tolerated that, where they are in their plan of care when it comes to spinal cord injury protocol, were VCs measured, were NIFs measured, that sort of thing. So in general, we do have to fill these out. This will continue into the Epic domain as well, but we've been a little busy, of course, and we need to kind of get back to our base roots, and that is putting in end of shift summaries or progress notes. I hope this is helpful. Thanks for watching.